Social Enterprise Scotland has been doing a bit of work recently, particularly looking at that whole public services agenda. I think it's, those of you who follow these kind of things on Twitter, I think we just passed 10 years of the Christie Commission report. Some people are always saying, well, what really happened as a result of that in terms of what's changed around public services. So it's a timely conversation, I think, for us to be coming back to. And I'll let Duncan do a bit more of that intro, but just what we wanted to do on today's session is give some really broad examples where social enterprise is really involved in that public services arena. So really delighted today to welcome Lorna Paul from Giraffe Health. So obviously covering health and that whole remit, which is a big part of the social enterprise sector. We're then going to hear from Alex Warren at the RISE Group. Again, employability is a big area that social enterprises have been involved in. We're then going to hear from Frank from HCT Group. Those of you who've been around social enterprise for many years, I think will be familiar with HCT, not based in Scotland, but very much a big public service provider in terms of public transport. So really looking forward to hearing from Frank. And then last but not least, we're going to hear from Trish at McLarenLeisure. So we kind of feel we've got a fair few of your public services covered in today's session. And I'll just hand over to my colleague, Duncan, now.
Hi everybody, great to see a lot of people here today. And as Naomi said, we've got a really diverse mix of speakers around all different types of topics in terms of public service delivery. I've just posted in the chat a link to our outline campaign around public services and social enterprise, and so you can have a look at that at some point. Just a few bullet points in there at the moment around what we mean by a public service campaign and what we're kind of hoping to achieve. So I won't speak for long because, as Naomi said, we've got a very packed schedule today. We've got 4 speakers, which is great. But yeah, please do have a look at that web link and just give us any feedback you have on our planned campaign around increasing numbers of social enterprises delivering public services. There is a commitment in the social enterprise action plan around social enterprises. So to quote the action plan, it says we will bring forward a programme to help improve collaborative commissioning and the role of social enterprise in the delivery of public services. So we do have specific commitments in the social enterprise action plan for Scotland as well around this kind of topic. So we're quite excited about how we drive forward that agenda. So without further ado, I will hand over to our first speaker.
Thank you, Duncan. So over to you, Lorna.
Thanks very much. Just checking you can see my screen. Is that?
We can.
Perfect. So thank you very much for the invite to come and speak to you today about our community interest company, which is called Giraffe Healthcare. So clearly, as Naomi said, we work in the healthcare space. So just to give you a bit of background about who we are and where we've come from. Now my slides won't move for some reason. Let's see if we can do it that way. There we go. So why did we set up this kick in the first place? Well, we know that there's an awful lot of people in the UK that have some long-term conditions, and even before COVID, or especially before COVID, a lot of people had difficulty accessing clinical services because of where they lived, because of their language, because they had work commitments. We can't always attend a clinical appointment at 11 o'clock in the morning or whatever. Together with that, staff shortages across the NHS, and then of course we've got the big issue now of COVID and long COVID and how services are going to cope with that. So my day job really is at Glasgow Caledonian University, and we had been developing a platform to try and support people in their rehabilitation at home. So my background is a physiotherapist, and how could we get physiotherapy to people who found it hard to access services? So that's really where this started, with a programme of research at the university, was well received, and people were saying, well, how can we keep using this? This is helping our service. So we set up a kick. Not all that long before COVID started, we really began to get off the ground and start to trade, and I'll tell you a bit about that journey. So we started with it was a physio platform, and we've since gone out to podiatry and occupational therapy, which I'll talk to you about. So what it is, it's an online platform. So if any of you have had physio, you've probably got thrust a piece of paper with a few exercises. It never looks as good as this because it's always in black and white. It's always on that paper the NHS use, like it's been through the toilet or whatever. It's that horrible paper. And we always have great intentions. We start to do these exercises, then we forget, then we can't remember, oh, what did she tell me I was supposed to do? And we know it doesn't really work. And patients told us it doesn't really work. So we developed the platform with lots of co-production with our patient users. And as I say, it's a web platform. It's mainly video based. So rather than little pictures, you have videos of the exercises. We try and use people that have clinical conditions as the actors in the videos, so that we've got different ages and stages. We've got fat people and thin people. We've got different ethnicities to try and make it as representative as possible about our patient population. Because if any of you have gone to look for exercises online, you tend to get a skinny blonde woman or you get a big gym buffed man, and that doesn't look like most of our patients. So that's roughly what the platform looks like. There's an online exercise diary, there's lots of feedback and so on. So what happens is the patient sees their own healthcare professional, they set up the programme using our platform, and then the patient has their own very personalised exercise programme that they go through at home, filling in their exercise diary as they go. Their therapist can see how they're getting on remotely and can adapt their programme. Hopefully, as people get better, we can make their exercises a bit more difficult. And there's a demonstration login if anyone's interested in having a look at the platform. Oh, my screen share stopped. Hang on. Does it come back again?
It has.
Sorry, I don't know what happened there. Oh, now we're going the wrong way. Sorry about this. Let's see if I can get these buttons back. Right. Okay, so sorry about that. So where were we pre-COVID? As I say, we were a relatively new social enterprise, and certainly compared to others that will be speaking this morning. So we had started to put it out there. We'd been to a few conferences, trade shows. We had people on free trials. We were getting positive feedback, thankfully, and a few hospices and third sector organisations had come on board and were early kind of adopters. We had a bit of work in NHS Forth Valley, which was around stroke rehabilitation and how the platform could be used for people after stroke. But we were in that way, do we have a long-term viable business? And then COVID struck. So what we did with COVID was we offered the platform free to the NHS, just as our way as giving something back, if people found that useful to try and keep services going. In reality, a lot of the rehabilitation services just disappeared during COVID because everybody was redeployed into ITU or vaccination programs or whatever. But we did at that point expand into podiatry and occupational therapy. So there was a wee bit of pivoting there. Our customers that we had said, we're not seeing patients face to face, as well as exercises. Could you do little videos around things like how to use your inhaler, how to use your walking aid? Because it's really hard to explain that to somebody over the phone or over an attend anywhere call. So we have a growing customer base in the UK. A lot of hospices, MS centres, and we provide the contract. We've got the contract for Marie Curie services throughout the UK, so they all use the platform from a physio perspective. Early work with the NHS, and I'll talk about that because clearly that's our big public sector organisation in Scotland and throughout the UK, and we've just had signed off our biggest contract so far, so all the podiatrists in NHS Lanarkshire will now be using the Giraffe platform. Because we're a digital health company, we can work internationally, so we're exploring opportunities in New Zealand, Dubai, Ghana, a couple of others as well, and again I can talk to you if anyone's interested about what we have to do to make it work internationally, and we're continuing to update the platform. So when we started sort of looking at our numbers, April 2020, we probably had about 650 patients registered on the platform. When I looked just the other day there, we were almost at 3,500 patients. So that's the top line on this graph. The bottom line is patients that are active, because obviously some people are discharged or pass away or whatever. So not everybody's necessarily an active patient, but we have between 40 and 50 new patients on the platform each week. And again, that number is increasing all the time. So the main thing I suppose to talk about today is the challenges in working in the public sector. But for us, there's also lots of opportunities. Our challenges are really that we don't interface directly with our users and the patients, because we provide the platform to the service providers. For GDPR, we can't always directly contact our users. So in terms of working out our social impact, sometimes that's a bit of a challenge. Sometimes accessing grant funding is difficult, because unlike some of the fabulous social enterprises that we know about in Scotland, we're not local community based, so we're not serving a local community. The NHS, I don't think, has any idea what social enterprise is. I think they think they sometimes say, but your social enterprise, can we not get this free? You think, no, you don't understand what social enterprise is at all. Long sales runway, they're not great at paying once you even get an invoice into them. And we have to go through separate information governance for each health board, and that's really time consuming, and that can take months. And I know it's really important we protect people's personal data. I'm not disputing that for 1 minute, but it's an onerous, time consuming bit of administration to go through that with each individual health board. And as Social Enterprise Scotland have been great in trying to get us at the table with key people in Scottish Government. Scottish Enterprise International are good at putting us in front of government people in other countries, but trying to get the right people in Scotland seems to be a big challenge, but we're plugging away at that. In terms of the opportunities, I've said that a challenge can be we're not working in a community, but that means we're not geographically limited. So we can hopefully have influence and impact on a wide range of geographical areas. We love partnership working. We work really closely with our customers and our potential customers to make sure that the platform is fit for purpose with them, because ultimately it's about improving NHS services, getting services to patients that don't necessarily access. You know, if you don't speak English, how on earth do you go for physio or occupational therapy? We can, we've got some of the platform in different languages, in Urdu and Arabic. And as I say, we're able to work internationally, and our running costs are relatively low. Unfortunately, we're not at the stage yet of having a big staff team. That's really obviously where we want to get to as we grow, but that's just a kind of slow build. And I've just been putting some images of some of the videos that are on. So we've got some paediatric content as well, as you'll see at the bottom. So just to finish with, you know, we're getting really positive feedback when we actually do get patients on board, but working with the NHS is a day-to-day challenge, I'm sure, like many other public sector organisations. And I'll stop there. Thank you very much.
Thank you, Lorna. I'm sure we'll perhaps pick up on some of those challenges and opportunities in the Q&A. So as I just introduce our next speaker, Alex Warren from the WISE Group, I'd always remind people, do use the chat and Q&A function, and we'll come to those at the end. But over to you for now, Alex.
Okay, thanks, Naomi, and thanks, Lorna, as well. Amazing to see the success so far and the growth of Giraffe. So really cool stuff to see. Thanks for having me on today. My name is Alex Warren. I'm the Strategic Development Director from the WISE Group. And for those that don't know us, the WISE Group is a UK-wide social enterprise. We were founded in Scotland, but we deliver across the UK. And our mission is about lifting people out of poverty. And we do that successfully. We do it at scale, and we deliver public services, hence me being on here to chat today. The way we focus on doing that, and in terms of lifting people out of poverty, we deliver employment support and employability programs at various different scales, from national government down to local community-based programs. We deliver significant programs in the criminal justice space through care and mentoring services for the Scottish Government, the Ministry of Justice, National Probation Service, again at various different scales where we impact, we reduce reoffending, we help people coming out of prison reintegrate and move to positive destinations, and we're very successful at that. We're a skills and training organisation, so we deliver accredited and non-accredited training to support our customers in terms of positive progression. And also we deliver fuel poverty and energy advice programmes at scale. We deliver these, and we've got plenty of examples of delivering public services that I want to talk about. We have probably some of the best examples. Fair Start Scotland, which is the Scottish Government's devolved employability programme. We deliver that on behalf of the government. Another employment programme that we're delivering right now, Job Entry Targeted Support, or JETS as it's more commonly known, which is a UK government and DWP programme operating at significant scale. We deliver that in Scotland, helping people back into work. Our justice programmes, from a public service point of view, we deliver for the Ministry of Justice. We have 16 contracts across England and Wales, supporting the probation service around helping customers who are being released from prison, and our New Routes mentoring through care programme in Scotland, which we deliver to all male short-term offenders across Scotland on behalf of the Scottish Government directly. And then from the point of view of our energy advice and fuel poverty work, Home Energy Scotland, which is the Scottish Government's advice and support service in terms of energy and fuel poverty. So we do lots of things from a public service delivery point of view, and we are a social enterprise. Just to give you an idea of scale, we'll help just over 41,000 people this year directly through the work that we do. And actually, we're launching one of our an impact sort of showcase today. So I'll pop that link in later, a bit of a shameless plug, but really excited to talk about the impact that we've had. And just to give another example, the JETS program that I made mention to from an employability perspective, this week, collectively, we celebrated the 4,000th person back into work on that program since January this year. So it just gives you an idea of the kind of work we do and the kind of focus and the scale. But from a social enterprise delivery of public services, I wanted to sort of offer potentially a slightly different viewpoint. Firstly, I'd say I think things in this space are improving already. And as Duncan said in the intro, there's some really nice, strong commitments towards the involvement of social enterprise in this kind of work. But I think the social enterprise sector and the third sector has acted quickly recently, and in many cases been an innovator for public services, for public bodies, for funders, in terms of delivering on their obligations. I think the pandemic's led to new ways of finding new ways of reaching customers, engaging with customers that's relevant to them. So I think an obvious example and an advantage of social enterprise delivery is agility and the ability of the sector to quickly and successfully adapt to external change in external environment. But the couple of things that I want to highlight just now in terms of this debate are procurement being one, and then leading to cultural productivity and discretionary effort. And these things being put in the lens of cultural fit. And I'll come on to what I mean by that in a second. So from the point of view of procurement, it's impossible not to talk about that today with the topic that's been set. And I think the challenge is what procurement professionals, what do they pay for? What do they look for? What do they measure? And are they measuring the right things? The funding for public services it always pays for that frontline service delivery, but doesn't always necessarily fund the other elements that are critical, that I'll highlight in a minute, that I think are critical to that, how we do that in a way that's truly excellent. With a classic model, a procurement model, we look at inputs and outputs and the technical advancements in the middle, things like training, etc. What I want to talk about now and what we've been focusing on is changing the narrative a bit on that and focusing on those inputs. The inputs that we're thinking about and talking about now are things like trust, values, selection, mindset, attitude. Because without doing those things successfully and focusing on those, the technical inputs and outputs, things, they're kind of meaningless. And done right, this leads to what my second point was around cultural productivity. And obviously directly aligning that with productivity, which is something that's always measured in a delivery of a service. This is why I posed the question around what value procurement professionals in public bodies assess cultural fit. Because I think if we did this properly, I've got no doubt that we would see even more excellent results as the right kind of organizations delivered the right kinds of services. Because what I mean by this, it's more than just numbers. It's more than spreadsheets and outputs and targets, which is often one of the key behaviors that are driven through the delivery of these services. What I'd say and what we would say as the WISE Group is it's more like people versus numbers, because people are what counts in the equation here. Because with the right approach, an organization can ensure that an intrinsic level of well-being and motivation from its people. And this is where people have a strong sense of purpose and are truly aligned with the values of the organization. And therefore the motivation within that organization is significant. And this is the thing that leads to more than numbers and more than outputs. This leads to discretionary effort, as I talked about before. And this, I believe, is where a service can go from being good to being great. But is this something that's really looked for? Is it a measurement that we're routinely asked for? But I hope it makes the point around finding the right cultural fit when procuring services, so we can truly deliver outstanding services that exceed expectations and deliver significant value add. At the Wise Group, we've put a significant amount of effort into this. We operate a remote first model, and at the heart of that is emotional intelligence. Trust is implicit, it's given everywhere, and well-being is at the center of everything that we do. And our values drive all of our activity, right from our selection process for new colleagues through to how we procure our own services. Our colleagues work flexibly and in a way that works for them, personally, for their customers, for their stakeholders, for their teams. And doing that successfully brings us closer to our customers. And this, from our perspective and what we are experiencing now, is it's led to huge engagement and motivation levels from our colleagues, and they are firmly behind our purpose. And what have the results been? Well, we've helped more people than we ever have in the last 12 months. We've built the strongest platform we've ever had in terms of financial platform for growth. We're seeing real positive difference in terms of productivity and performance. So for us now, and from the perspective of how well we can do these kind of things, our challenge, one of our challenges lies in how we measure productivity. What we want to focus on is tracking productivity through the evidence of discretionary effort that our colleagues deliver, our purpose and our values, and the resulting motivation that gives. What I'd also say, and what we talk about a lot, is we know that this comes with a bit of a health warning. We know that discretionary effort from our super motivated colleagues, this is relevant everywhere, but we look out for this, is that it can quite easily accidentally lead to burnout. So for us, this is a key watch out, and it's something that we work hard across our teams to look out for and to avoid. So with this mindset in how we decide and we select for the delivery of public services and a growing role for the social enterprise sector in this, we hope to see the start of the end of that race to the bottom in terms of decision making. And if we are truly assessing who delivers services and how, then we'll really start to unlock potential. And what does this lead to? Well, it leads to sustainable contracts. It leads to financial success, cultural success, and societal success. Just quickly, I think on top of that, outside of some of the views on procurement and selection, I think some other advantages that to touch on. Engaging social enterprise delivery effectively helps to guarantee social value and socially driven delivery with commercial principles, which I think is crucially important. There's a strong alignment with the growing needs for elements such as community wealth building, which we see again and again through government policy, particularly in Scotland now. What about customer perception? We know there's a rapidly increasing change in how people want to see services delivered and products developed, and where people put value. We know there's a worldwide drive towards growth of sustainable or socially responsible business. So spending behaviours, consumer preferences, social value are key drivers for that. So we know that people want to see more socially driven delivery of services. And then there's community benefits or social value or CSR, or whatever element is being used in the selection and the procurement and the commissioning of public services. But social enterprise delivery helps to ensure that this moves away from the danger of it being a tick box exercise by someone to it being a real and lasting thing. And there's plenty of other advantages I'm sure we'll talk about through the debate today, and we could talk about all day. But just before I sign off, I want to just offer one slightly different point of view, which I think is relevant and significant here. The involvement of social enterprises in the delivery of public services often is a barrier to this is often scale, because the service itself or the scale of what's needed is too big for some social enterprises to consider to even be in the race. And that's why we see large private enterprises dominating some of this space in terms of the delivery of public services. But I suppose what I'm arguing here is that social enterprises have a role there too, in terms of partnership and collaboration. I've got various examples from a Wise Group perspective and beyond, where partnership with large organisations and to deliver these services has been successful and crucial. Now, don't get me wrong, there needs to be a strong alignment in terms of values and aspirations and motivations from all organisations involved. But done well, it really unlocks potential and growth. And it unlocks some of the indirect advantages that may come as a result of this, that wouldn't necessarily been possible without that level of collaboration. So there's a view here, there's a role here. I think it's important to shine a light on. It's a different point of view, an interesting one, but I think it's important nonetheless. So I think that's me run out of time, so I'll stop chatting now. But thank you very much for having me. Looking forward to listening to everybody else and for the debate later on. So thank you.
Thank you very much, Alex. It's interesting, as you were chatting, there's a few points I wrote down about kind of risk and big is better. And so I think that kind of conversation that you started there about, is there a role for us within a supply chain to another provider, is quite an interesting one. And I'm sure we'll come back to that in the Q&A, both kind of that sense of direct work with public services and indirectly through supply chain. So thank you for introducing that topic. I'm going to ask Frank to come onto screen now. HCT Group. Well, I'm not going to tell you what they do because I know Frank's going to, so I'll just hand straight over to him, given I know we're tight on time and want to make sure all our speakers get a great chance today.
Well, first of all, thank you very much for inviting me to come along. It's really wonderful to hear about some amazing examples of social enterprise in Scotland. I find it just really inspiring what's going on in the scene up there. So it's a pleasure to come along and talk to you about HCT Group and what we've been up to. I'm Frank Villeneuve-Smith. I'm the Communications Director at HCT Group. HCT Group is a social enterprise in the bus industry. So what's the big idea? First of all, we do loads of commercial bus. The idea of that is to make some money that allows us to pay for a broad range of community transport service, or at least to support it if we can. And it's those services that go on to create our positive social impact. That's kind of the simple story. We were founded back in the 80s as one of the many wonderful small-scale community transport operators up and down the country that provided community minibuses for local community groups, transport for older and disabled people, but it was all grant funded. And with grants under threat, we started our kind of social enterprise journey and kind of started it quite early. We won our first contract in 1993 as a mechanism for kind of supporting those elements of grant funding to do what we wanted to do. And over the course of time, it became clear to us that if we were going to get kind of like to a viable scale using trade to support community impact, we were going to have to get really good at buses. And so that's been our kind of journey over the course of the last X number of years. And so it's worked okay. We are significantly bigger, having grown from a couple of £100,000 back when we first started trading to roughly 8 million this year, 30 odd million passenger trips on HCT Group buses, 1,600 of us, and about 700 vehicles. And the idea is that there's a lot of trade running around, and that then goes on to support our high impact work. We are almost exclusively funded through contracts, and we operate contracts in a variety of different places. So we do 17 London Red bus routes under contract to Transport for London, mainstream public transport services elsewhere. We do the kind of contract work with local government that is in line with our values, but isn't kind of like the extra stuff we do. So special education needs transport, where we're focused on better outcomes for those learners, and social services transport for kind of older and disabled people, things like dial-a-ride, that sort of thing, and a bit of home to school transport where that's a thing. And almost all of the stuff that we do, we're competing for either local government, transport authority, or kind of central government contracts against big multinational operators. We've spread around. So we run a variety of operations in Yorkshire. Those are a mixture of mainstream bus contracts to local commissioners and some school transport, and also a little bit of a dial-a-ride up there. In Bristol, we run a mixture of tendered bus services from the local authority, some subcontracted work to other operators, And also it's a big centre for our community transport high impact work. We're at our largest in London, where we started out with red bus services, SEN, special educational needs transport, and adult social care services. And we're also, strangely, the sole bus operator on both Jersey and Guernsey. Jersey makes for a really good example because it's an example of commissioning where the government there wanted to commission a partnership rather than a subcontractor, because the network there, they chose a social enterprise because they wanted a network that focused on the social and economic development of the island, rather than it being profit maximizing. So the impact we have is all the commercial work. Its idea is to support. We're still doing the same kind of community transport work that we did when we were founded back in 1983. So it's transport for community groups, holding the minibus assets of our communities in common. We provide a variety of individual transport services. This could be community buses, dial-a-ride, and a few other bits and pieces like that. And also in the kind of a model we'd like to see much more of is the Jersey model, where we're providing public transport for public benefit, working with commissioners to deliver transport networks that are for economic and social development rather than kind of what the market says. Now, as you might imagine, it's been rather challenging in the pandemic to be a community transport provider. So we swapped everything around of late. We've been taking things to vulnerable people rather than taking vulnerable people to things. And so that means that we've distributed literally tons of food, medicine, PPE. We've even done little chippy runs to raise the morale of the service users of our dial-a-ride services in Yorkshire, just to raise their morale as they were kind of locked at home. Now we're emerging, fingers crossed we're emerging. We're trying to help the vulnerable service users to regain their independence through kind of small getting people out of their homes kind of work activity. Now, as I mentioned, almost all of our money comes through trade with the public sector. Some people, when we talk about that outside of social enterprise, would think that being a social enterprise would be a self-evident advantage in our trade. But actually, in road passenger transport, nobody cares. So it's all about focus on price and price and price and price. Maybe sometimes quality, but really just can we have it the same as last year, but cheaper, please. And we experience what might be charitably described as unambitious public procurement practice. But we also see that being a social enterprise is a real advantage in the public sphere. Because if you have a desire, like, well, social enterprises I've met, for social change, then that's another way of talking about innovation. And when we talk about innovation to commissioners, they can listen. And the other thing, particularly true when a lot of the delivery is done by bigger multinationals, is we want better outcomes for citizens. And so do almost all of our commissioners. It beats in their hearts. So we share that value, which means that what we can offer better partnerships, higher quality partnerships. And at least in road passenger transport, it would be fair to say that, I mean, how nice do you think it is doing business with giant multinationals? Well, it's probably not very nice. And so in terms of just getting those better outcomes, that offer we can make is really significant. But because almost all of it is public sector and very little of it is imaginative, we campaign for better procurement. We're not talking about new regulation here, because actually there's a huge number of freedoms in existing contract regulation. It's just we don't see them used very often, particularly not in our neck of the woods. So we campaign to see like social dimensions in most economically advantageous tender actually included in tenders. The use of reserve contracts, which are kind of like a special move to say, no, we're just going to commission from a social enterprise. Now, we want to see more and more communities involved in service design, but particularly in contract award. Even though you can't say, please just give it to the social enterprise, when you involve communities, they know the kind of service delivery they want. And it's a real kind of pressing down on the scales. And also there's all sorts of interesting stuff that local authorities can do to solve deep problems, like innovation partnerships, which are almost never used. So what we would find is when we would go out and we would pitch to like a local authority, we would often find kind of bold commissioners who would be willing to try and something new, something that could change the landscape of certain elements of the service delivery. But then procurement says no and legal says no. So we actually went to the trouble of, we translated procurement law into plain English as a publication that we shared for decision makers to show to their legal teams. Now, that's a summer of my life I'm never getting back. But the idea is if we can encourage our commissioners to use the freedoms available to them in a pro-social way, it will allow us to have that dialogue with commissioners that allows for service design to be much more impactful, and it plays right into the hands of the social missions of many organisations in the social enterprise space. Now, I know that Scotland has a very similar regulatory framework, not exactly the same, very similar. So I've got like a question for everyone is, in Scotland, are the pro-social powers in your public contracts regs from 2015 actually used? I'd be really interested to find out. And that, lovely people, is me.
Thank you very much, Frank. Again, lots of kind of thoughts stimulated in my mind as you were speaking. And, you know, I think here we're used to very much also the lingering around community wealth building, but I think there's still a sense from social enterprise about how is that translating in practice. And I think that's the thing about that kind of the link between the legislation and what's possible into what actually happens. It's quite an interesting challenge, I think. We will definitely come back to that. I'm conscious that we're obviously due to kind of finish in 20 minutes. We may end up going 10 minutes or so over, I think, today, because there's already lots of questions if people are happy to stay on, because I don't want our last speaker in today's session to feel pushed about talking about leisure, another really important aspect, I think, of public service delivery. So I'll just hand straight over to Trish. Thank you, Trish.
Thanks very much, and thanks very much for having me along this morning. I'm Trish Thompson. I'm the Centre Manager at McLaren Community Leisure Centre in Callander, a small to medium rural leisure centre that provides sports and leisure facilities. Our mission is to provide the highest quality inclusive sports and leisure facilities for our community and visitors to the area. So we set up in 1998, so we've been socially enterprising for some time now, and because we serve this sort of finite demographics, we sit with dual use, serving the high school for their sport and leisure facilities. We have a 20-metre pool, we do swimming lessons, we have a sports hall, we serve for badminton and volleyball and basketball and netball, fitness suite, soft play, climbing wall. So quite a lot for a rural community to have. We have 1,400 square kilometres that we serve. So from Tyndrum over to Gartmore and Loch Lomond side. Our town has 3,500 people. So you can probably understand that with those numbers, it's always been a challenge. We don't have 100,000 people sitting on our doorstep, but we are here to serve a really important aspect of this very rural community, widespread community. So the impact of us not being here would be, for some, a 2.5-hour round trip to the next local facility. And obviously the massive impact to our 650 school pupils, high school pupils that are right next door to us, not having a swimming pool and the access to that, which is really important given that we're surrounded by lochs and open water here. So it's incredibly important that swimming is learned from a young age in this area. So our social impact outcomes are to provide those sport and facility activities. We provide opportunities for people of all ages and abilities to participate in sport and physical activity, both to improve their health and well-being and develop skills to participate and compete in various sports. Employment and training. We provide employment for all age groups and training from first aid and lifeguarding, climbing wall aspects, fitness suite inductions, and cafe areas around about food and hygiene. And then providing that rural access that I spoke of. We break down the barriers to people for accessing service for our local community, where there's little way of alternate public provision and where travel times are so large. We strive to support a stronger community. We support a more resilient community by engaging the community and volunteers, by helping to build links with other groups and achieve wider strategic development aims. And then supporting the local economy. We contribute to the local economy both through the economic impact of services we offer and through providing facilities which support visitor economy and other groups and to other groups and businesses. So through all of our health and well-being, I would say are probably from 1998 our best year of support to our community and visitors to the area was 2019-20. And then COVID came along and knocked us all for six. But we stepped up what we could between furlough and lockdowns, and we ensured that we were reaching out to our community in whatever way we could, whether it was online classes or having drop-off sessions and where people could take equipment home and participate in these classes with some of the fitness equipment that we could give them. And just latterly, it's been COVID jab centres, testing centres that we've supported the community with as we get back to some form of normality here. And I think we've been key in supporting this rural communities' access for their mental health and well-being. I think everybody has struggled with the change from hybrid working to working at home permanently, and so as we come through this COVID or learn to live with COVID, I think that the feedback has been that we've been key for this sort of environment. We've adapted our business to make sure that CO2 levels and social distancing, sanitizing, all of those things that go hand in hand with people gathering in any area is been taken into consideration, and we make sure that our participants are as safe as they possibly can be. We're looking to adapt with some funding that we've received. Some of the aspects, we've done a huge amount of work in our building. I would say our building is quite large for the rural area, but that's because we share it with high school use and the community use. So we've been adapting some of the more redundant areas of our building to make sure that our business can pivot and adapt to the needs of the community, whether that's events-based gathering or dance studios and learning for life spaces. So we've taken up on the Adapt and Thrive Fund and are pursuing online booking system, reducing bottlenecks of people standing around and trying to pay for swimming lessons and whatnot. So that's coming through the process. Bleacher seating and division of areas, airflow through the centre where we can reduce those CO2 levels further, making sure that our participants are safe. So there's a lot of plans underway to make sure that the business stays flexible and adapts and overcomes these challenges that are ahead of us and with us at the moment. And going through that, I would definitely say that our relationship with our local authority, Stirling Council, has been key. So they pay probably half of our income for the high school use of the leisure centre and some of the satellite primary schools use. So in that relationship, we've made sure that when the school couldn't use us, that we adapted our situation, and that we became, as I've said, drop-in centres, COVID jab centres, and other aspects that the community would require. As we've reopened, we've adapted and made sure that, for example, Storm Arwen, which is why I don't have slides today, his calendar has been in blackout for over the weekend since Friday evening. But making sure that we could support the community as soon as we got up and running again. Again, it would be 2.5 hours for people to travel to the other areas that had powers, a round trip for them. So I think it's key, our provision of services here, and even if it's just a warm, dry space that we've been offering over the last day or so, just while we had power back on, warm showers and hot drinks and stuff like that, then we support the wider community through these kind of things. And I would just say on my thoughts on public services becoming social enterprises, I think anything that takes care of that triple bottom line is a great thing. A concern for me is those where the funding is simply moved from one pot into another pot, and that I am suddenly vying for funding for something that's very, very ring fenced out in this area, that, you know, we're operated for the community, by the community, with a volunteer board of trustees, that their vested interest is the health and well-being of the community. So I think if the other public services that are similar to us providing sport and leisure can ensure those triple bottom lines, so taking care of your people, that's your community, and taking care of your staff, living wage organisations, and ensuring that they're well taken care of, and you're investing in their learning processes. These are great things. We've always worked with Climate Challenge Fund, Zero Waste Scotland, and the Carbon Trust to ensure that we are reducing our carbon footprint with a swimming pool. It's not the biggest swimming pool, but with a swimming pool, you can imagine that our carbon output is significant. And we have worked over at least the last 10 years to make sure that everything that we are doing is reducing that carbon output. And I think that the other public sector organisations, you know, need to be ensuring those kind of things as well, and that's all good practice. And of course, then it's just on to, you know, you're making sure that your profit is put back into the building, the people, the facilities, the services, and those clear aspects of what makes us a social enterprise, and that it's not the vested interest that could possibly sit on boards. I'd like to think that our councillors are there to support our wider community interest. They're there to serve the constituents. And while absolutely they should have a place of coming to the board to say, this is what our constituents want, that's great. But I don't think that there should be a loophole. There's shadow director issues that come up from people sitting on boards that perhaps more need to attend them in a different way. And I think that this social enterprise has that level right, where we have good comms with our local authority, and generally can speak to anybody in any department to push things through, or to, you know, take care of our community. And those are good. And if that continues with the other sports and leisure facilities on social enterprise aspect, then I think that should be a good thing. So that's all from me today.
Thank you, Trish. I'm going to invite all of our speakers just back onto the screen. I've got a few questions. I'm hopeful. Just send me a message in the chat box if you do need to definitely be off precisely by 12:30, and I'll make clear that you're not just faking a loose connection. It's fine. I'm just conscious that there's a couple of questions I just want to bring to people. If you're happy and you're able to stay on for just that extra 10 minutes, that would be great. I'm going to perhaps start just with a question. I was reflecting as everyone was speaking. Obviously, Frank, you talked us through kind of the journey at HCT Group. I think it's one I know I've been following since about 1997 in terms of remembering that time when you won the first contract. Obviously, Alex, you spoke about being able to win contracts and operate UK-wide. And I just wonder, for those organisations perhaps at a slightly earlier stage, which is why I'm going to put this question towards Lorna, as someone that's perhaps a bit newer in the field, what do you think was the real challenge perhaps in around getting the first contract? And how did you manage, I guess, to persuade people, if you hadn't got that track history, that the perceptions of risk weren't there with you as an organisation?
I think that's a really good question, because the first question people ask us is, who's already using this? And when you don't have that first contract, that's the challenge. So I think our first big NHS, so that's our first big public sector contract, as I say, is with NHS Lanarkshire, and I'm sure that's now opening the door. In fact, I know it's opening the door to other health boards. So what we did was we started off with a smaller contract, actually. So they came first of all for 6 licenses for their musculoskeletal service. And that went well, and that opened up the door to discussion with our head of service, who then came and said, actually, you know what, never mind that 6, we need 60. So that was the kind of way in, was a smaller, I suppose, less risky for them. Let's see how it goes. We also involved them in the development. So if you remember, we kind of pivoted a bit to include podiatry. Well, I'm not a podiatrist, never pretend to know what content they needed. So we worked closely with them to develop the content, and it was obviously content that they really needed to deliver their services and, you know, to deliver quality of care to their patients. And if I'm honest, we did them a bit of a deal, swore them to secrecy, never to mention the deal we had given them to other health board areas, but it was just to get that first contract. Yeah, shh, don't tell anybody. So that was our strategies.
Thank you, Lorna, because I think it's that first one that's obviously, it's the hardest one to get, like you say, that track record, that getting through the PQQs, the pre-qualification questionnaires, that sense of, is your turnover big? And it perhaps leads me into a question I was going to ask Alex. I was really interested by the comment you were making about how do we, and it came through, I guess, in terms of Frank as well, that kind of, we're there for citizens and that sense of cultural fit. And I wonder, I think you made the comment about whether procurement teams perhaps always look for the right things. And I wonder, how is it that we can perhaps get over some of those questions, perhaps around perception of risk, and particularly perception of high risk, that sometimes I think our social enterprises are seen to have?
Yeah, I think it's how you get over that element of risk is a tricky one, because you're often, and it might sound a bit sweeping, but you're often dealing with people who are are very risk averse, and the process in which any organisation looking to win a public service will need to go through to overly demonstrate that they are not risky in any way, shape or form. But I think I suppose what I was making reference to before, and what we're quite passionate about, is how we move the spotlight on this a bit, and how you can, that I think cultural fit is so important, because if you've got the right kind of organisation who's got the right motivations, values, attitude, capability, then it takes it, rather than looking at it from a lens of what's the risk here, it's done right. It flips it on the other way and said, actually, we might be procuring X, and it's this thing between these lines here, but what we would get is potentially so much bigger, because rather than an organisation, and probably all of us, with all of the different shapes and sizes of the enterprises on this session today, will have had something where the behaviour of their colleagues of their organisation has been driven by the required outputs of a service, a contract. So, Frank, it's about running buses on time, or the number of passengers you've got. So some bland metric that then drives the behaviour which then affects culture, which then, and it goes through everything. Whereas if you look at it the other way and say, well, actually, what can be achieved? Yes, we need to hit these outcomes, but the bigger part of what's achievable with the assessment of the right fit is phenomenal. We've got loads of examples of, if you think about employability, where have we done what the contractor said? Yes. Have we hit the outcomes? Yes. But actually what we talk about the most and what we focus on is not that. It's about the impact on that individual or that large collection of individuals and the things that have happened to them as a result of the service that they've got. And when you start to take the blinkers off, I think that's when you start to create opportunity. And I would hope, and I know this is a slow process, but you move away from that term or that thing of being obsessed with risk, and we want people obsessed with opportunity.
Yeah, it's really interesting. I was thinking actually as you spoke, I mean, my background previously was in the waste and recycling sector, and what we saw in that is the innovation started in the non-profit sector, and then it became mainstream, and the contracts simply became too big for many of them to go for, and the perception of risk actually, certainly down south, kind of almost obliterated that sector, which is a real shame, I think, in terms of where we're at now. And I was reflecting as you spoke on that sense of, we always used to say that sometimes if you've got a local organisation running your service, and people often think that sense of big is better, and I guess the Carillion story is perhaps the most recent example of when that hasn't worked. And I have to say, actually, if you've got a local provider, they need the business as much as you need them to run a service, and that's very different to being kind of having one contract, or having one contract with your local authority. And I mean, your local authority is very different sometimes to kind of having 20, 30, 50 contracts, where actually you don't need that relationship in quite the same way. And I think there's something for me about how do we move that to being a conversation about procurement not being just a transactional thing, but truly a partnership thing that I think you get from more locally based organisations. So just interesting reflections. Frank, I can see you've got your hand up, so do come in, and I've got a question I'm brewing ready for you too.
So, I mean, I'd like to support what Alex has said. I mean, we are in road passenger transport, where we get a lot of our contracts. It's a little bit colder. And so there is an enormous expectation that we'll run a safe and reliable service. And that's like the basic entry level thing. And that's what when we first meet a new commissioner, that's what we pitch on, because they don't know us yet. And so what we try and do with often a small contract is we'll try and use that as a platform. When we've done something practical, that earns us the opportunity to start talking about the other kinds of things that we can do. When they're in a meeting with us, then those values as a social enterprise of our relationship with them will not be like this gamified nightmare that it can be dealing with a big multinational. And that then provides these opportunities for further direct, further and further, more innovative, more community focused, and more novel service delivery designs. But we find that we have to do quite a lot of the boring stuff first before a relationship is strong enough.
Thank you. I think it's helpful to get the perspectives from different people as well. I'm going to perhaps ask you one question while you're unmuted, Frank, as well. We're flitting around lots of stuff. This is such a big agenda. I could ask questions, I think, all day. I won't be, don't worry. I'm interested. Obviously, I asked Lorna the question about that kind of startup stage. I almost want to do the reverse with you. You've obviously now got to a point where you've got significant turnover. You've won a number of contracts, and financing growth can often be a challenge for social enterprise. And I think you touched in your presentation as well about local, was it you? I think it was Lorna that talked about this as well, in terms of local authorities can often be quite slow to pay. And I just wonder, particularly if you're really looking at public service or public service contracts as your income source, how do you manage growth and raising the finance to enable you to grow in this kind of marketplace?
Well, it would be fair to say HCT Group has kind of participated in every stage of the development. by participate, I don't mean in its development, I mean in using it, of the social finance infrastructure. Basically, I've been with HCT Group for since 2009, and there has never been a time that we have not been pursuing or working with some form of social investment. Now, basically for us as well, we're a bus operator, we're really capital intensive. So in terms of going out and securing finance, it's not appropriate for every social enterprise out there. But because that's the case for us, we've been real kind of users of that kind of marketplace as it's emerged, and we still are. We've still got a range of kind of social lenders who are really vital to our success.
Thank you. And I mean, I know we've run sessions on social investment, and certainly in Scotland as well as accessing some of the UK schemes. Some of that's there, and there's all sorts of support people can get around that, because I definitely think for those bigger contracts, it's certainly become a way I've seen lots of social enterprises really be able to tackle that kind of finance for growth agenda. Trish, I haven't not got a question for you. There's always a question for everyone on these sessions. Every speaker I think that we had on talked about agility, and I think, you know, I'm remembering the trips to the chip shop, the move into podiatry, and I guess from yourself, that kind of sense of suddenly becoming COVID centres, and that sense of being able to quickly shift what you do. And I just wonder there's two questions I wanted to ask you. One is that sense of how do we get those stories across about agility in a way that actually influences that public services arena. I think you talked a bit about kind of local councillors, and do you use storytelling and some of the people you've supported to help get those messages across at a political level, or is that something that you don't do or wouldn't recommend?
We have done previously, but certainly not since COVID started, and since we've been living during it. I think it's something that we probably need to get back to. I think sort of driving forward and sort of lobbying a little bit more and stuff like that. But yeah, the political storytelling is important. So I think our key document is our social impact document, and it lays out a host of just, you know, people think of us as a small sort of rural, you know, does it matter, all of that kind of thing. But when you see the figures and the impacts that we're having on these rurally challenged lives, then yeah, it's very, very clear. We need to get back to that.
No, it's interesting. I say down in Dumfries and Galloway, I would love a McLarenLeisure here. I think we have certainly all of our services in that kind of arena are centralised in the one big town, which is a 60-mile round trip, and you're kind of like, this doesn't really work. So I think the rural communities and public service agenda is really interesting for social enterprise, and I would love to be an area that we really see growth in. I'm conscious we're already over, so I'm going to ask perhaps one question, and I'm going to put it to Frank, because you raised the point about legislation a little bit, but it might be unfair because it might be too Scotland focused, I think. So I'll also ask perhaps Alex if he's got a perspective on this, or any of our other speakers. But up here, there's quite a lot of talk about the whole community wealth building agenda. And I'm just really interested in, does this offer another opportunity and another way in for social enterprise, or is there still the challenge of how that translates into practice? And then just to broaden that question out slightly, and I certainly don't want to get political on this issue, but has Brexit actually offered us an opportunity here? Because I always used to hear that European legislation was the big barrier to why things had to happen the way they did. Has that have we got a new opportunity now we're less tied by that, or do you think nothing has changed?
I'd like to address the European regulation point, because I was kind of forced to write a translation of these regulations. I've got too much knowledge of the geeky procurement law, and the tragedy of these regulations is that they provide the opportunity for such pro-social and pro-social enterprise procurement if they're applied appropriately. And I mean, exactly the kind of wish list stuff that you would want. But those provisions available within the regulations, including the 2015 Scotland regulations, which I took a quick glance over before I came on, you can do all the things. Commissioners just didn't. And so one of the things that's why we've never really thought to campaign on changes to primary legislation, because actually all the stuff you want can happen using the existing regs. So it's a change. What we want to see is a change in the culture of procurement. So all of the measures that Alex has talked about in terms of how to start talking about the things that are actually important. Yes, you can score tenders on that as long as you're clear about what they are, but no one does.
Thank you. I think you're almost preaching to the converted on this audience here. We see the legislation changes, and I think that's why I think we all sit there and think there's some great stuff coming through on that community wealth building agenda, but there's a sense of perhaps a slightly cynical perspective sometimes that I know comes from organisations on the ground as to, will this really make a difference? And it's about that cultural kind of change that you're talking about. Alex, I didn't know if you got a final comment on that, and then I've got just one quick fire question for all of you.
I suppose the one thing I would say is I think Frank's nailed it. And I can see everybody nodding when he was speaking, because it's about cultural change within how these services are commissioned and procured. Most of the things we've all kind of talked about are possible. It's about being bold and brave enough to do it. And like, I suppose, and then I'll put this back to the other side and say, I think we all understand culture change is not overnight. It takes time. So we've got to keep having these conversations. We've got to keep pushing this narrative. And any good example of this, and we will talk about it all day long, because we believe we've got some of the key ingredients for this in terms of how we now operate. And we all do, all of us that talk today. So we need to keep bringing these forward and encouraging our colleagues who sit in the positions that are able to influence the decision making and the processes around this, that these things are a good idea. And then I suppose with the community wealth building side of things, that's a movement that is growing in Scotland. But I would also say, again, it's kind of fairly early days. I think there's fantastic opportunity that sits with that, because it puts the onus back onto local delivery. It puts the onus back onto the opportunity, the wealth that is created, being focused back into that area. And I would think there would be phenomenal opportunity for organisations like ours. McLarenLeisure would be an amazing example as well, through a bold approach to community wealth building. And what's happening in North Ayrshire, I think they've really taken a leap on a UK basis. They're really pushing forward with this. But going to look at what's happened in Preston as well, that's the other great example of where community wealth building, again, it's taken time. You look at what they've achieved. It wasn't 12 months. It was a longer process, but it was about culture change. So I think, we've got to, there's always opportunity within this. And I'll always look at the bright side of things on that perspective.
Thank you. Okay. Conscious we're 10 minutes over, it really is the last minute quick, and the idea is a quick fire question just around all five of you. If you were to give one tip to commissioners and one tip to social enterprises around this agenda, what would it be? And Frank, you're unmuted first. If you all just take it in turns and come in, that'd be fab.
To commissioners, I would say, read the regs. Yes, you can do what you need.
Thank you.
I'd take that to a next level and say, come and talk, come to these sessions, come and listen to this kind of stuff, and understand what's possible. Because when you understand what's possible, you'll start to push the boundaries, use those regs, and make a positive difference.
Yeah, use the regs. Actually, I wrote down immediately as soon as Frank said read the regs. I'm like, no, use them. Lorna?
I don't think I've got anything to add. I think Frank and Alex have nailed it, haven't they? Come and speak to us, and I think just trying to get them to understand, certainly in the health sector, that you know, a social enterprise is a business. It's not a charity.
Thank you. Trish?
I agree. Use the regs. It's about reaching out and coming out and seeing, you know, how that can work. And people that are already doing it, you know, so why double up? And yeah.
Thank you. And then just, sorry, Trish, I cut you off.
No, I was just going to say just what's already been said. That's all.
Thank you. And then the one tip for social enterprises looking to get into the public service arena, and then we'll close on that last comment.
I'd say until you know them really well, your social enterprise status won't win for you. That's all going to come when you build the relationships, win on the grounds of the things that you see in front of you.
Thank you. Alex, you've unmuted next.
Yeah, I think kind of stolen my thunder a bit there, Frank, but I think, you know, I talk about this a lot with my colleagues. It's about relationships. Even in private enterprise, it's still about relationships as well. So we look for shared value in everything that we do, and we're not interested in things that are going to be purely transactional. So we won't approach stuff if we've not got a good relationship, and the right people don't need to fully understand who we are and what we do. So relationships really, really important.
Thank you. Trish?
Yeah, I think it's, Naomi, it's what you touched on that we need to do is better storytelling and just making sure that you're, you know, forging your way a little bit, sort of your head above the parapet. So if you can forge those relationships and show your worth, and then a lot of that can speak for itself.
Thank you. It's that point about impact, I think. Know what your impact is as well. And the last word just from you, Lorna, and then we'll close today's session.
I think just for people new coming into dealing with public sector, I think just to be aware of the timelines, that, you know, building these relationships are not quick, and to learn from people that have cracked the nut already.
Thank you. And yeah, I was just going to add that a last tip from me: don't wait till a tender's out. Look at when a tender's going to be coming up, because if it takes time to build the relationships and you don't have one, and the tender's due out in 2 years' time, you've got 2 years to build a relationship before the tender's out. So, you know, look at what might be coming. Don't just wait until things are announced, I think, in terms of relationship building. I'm sorry we overran. I guess a consequence of having 4 great speakers, and I think such a key topic, I think, for the social enterprise sector. So thank you all for joining us today. I know we'll be coming back to this as a kind of a key topic, and obviously following on with what Duncan said at the start, you know, we're doing much more around this moving forward. So thank you everyone to coming, and thank you to our speakers, and I hope you all have a great day. Take care.